death. It's
best things. Facilitation of bills, sectors, policy, because they are mothers.
Nabuire.
Thank you. Thank you, Mr. Speaker, for the opportunity to contribute. I would like to be part of the Linda Mama package, but it was scrapped off. So currently, most mothers with this condition are not informed that sometimes patients are not.
Senator Nabuire, you are entitled to just one supplementary question, which you've already asked. Kindly take your seat. Senator Hamid.
Mr. Speaker, free thing when we inspect, hospitals, adequate beds, delivery, you have a maternity, looking at awareness on the right of one last thing is that how do we link that monitoring of these programs to outcomes, looking at maternal mortality. Bwana Waziri, I had a motion. I think my motion went through, and so I think the hospitals need to have a wing for what we found it very, yes.
My question will be Linda Jamii. Did we at any, as you transit to Linda Jamii, can you give us the package so that you debunk the street political fraud by Senator Kalwale, so that Kenyans, this is the only forum. We don't want Senator Kalwale to go to Malinya and mislead people that shifting from Linda Mama to Linda Jamii is a fraud. You have the opportunity to shine, Waziri. I yield.
Senator
Jamii, can you give us the package so that you debunk go to Malinya and mislead people that
most of these
shifting from Linda Mama to Linda Jamii is a fraud. You have the opportunity to shine, Waziri. I yield.
In terms of detaining policy in the ministry,
you have the opportunity to shine, Waziri.
Kenyans are paying. In this, maybe part of that report, are people, Jamii, what do we do with living here? Your ID number, this test, what do we?
Opportunity and the ministry that he has a neighbor, but you can never boast that he would do better to speak about Linda Mama and one of the benefits that does. So my question is prevention, because we have always been told that.
Honorable Speaker, Waziri.
Honorable CS, you may now proceed to respond.
For Wasingishu and the chair, it was very unique to MTRH IDs, and we have told the question to my Senator Boni Khalwale. I will not take the advice because I'm here to answer questions. Boni Khalwale is also a member for it to reach that level. And SHA covered 60% of the. There was no full coverage for NHIF, so SHA will cover the bit that is required by law for SHA to pay. There is no. I have patients, and if the bill is on the part of the family members and relatives of that patient. So, and I think we did our bit. If I go to Linda Mama, first there's no Linda Mama that exists. A transition was done, a more comprehensive, better Linda Mama is now anchored in SHA. And Honorable Speaker, I said it when I was answering the question. And in the answers that I have given to the Honorable Senators, if you look at it, there's a table. And I'll give you an example. Linda Mama, for level 2 and 3, were paying 2,500. For level 4 and 5 and 6, it was paying 5,000. And in fact, there was no equity. They were paying more for faith-based and private, and less funded, more comprehensive. Any delivery that takes place in our country, if you are registered From the for cesarean, we have moved, it covers comprehensively. But for will require data, and you can look at it. Not predictive. Mama, every mother in our, we can give you those who go through SHA. Since SHA in 7,000. My senior, the balance, the family will, but you can do better. Again, on with Honorable Mandago, let me just read the package, the SHA package, benefit package. Require medicine, drugs, procedures. This was not found in Linda Mama. It can only be found in Linda Jamii. So Linda Mary system for our mothers. If a mother exceeds 3 days, as he said, the SHA package reverts to 3 days. The hospital is system, the SHA. Honorable Senate Minority Leader, I agree with you. We have a serious problem in the implementation of the primary health care fund. Level 2, level 3, and some of our level 4 sub to register as SHA members. They do need to pay money appropriated by Parliament. Talking about it. They ask members of the parliament. And we are ready to give you. You have passed. 2 maternal mortality figures you are giving, and I am ready to provide. I have the names of the patients, of the mothers, and I have the names of the newborns. I think for record purpose, before the strike to the nation, that I agree that, so please, that information is an injection under SHA. The senator for the speaker that you ask a question, but because I'm going on record and the Senate, it's good to listen. The question was policy, and I want to tell him that policy does not allow definition of any patients, including mothers, such facilities for appropriate. We want the leaders to report to us, and we have a call center. Citizens are calling our call center. They want to ask on SHA. They can, on Honorable, enhance the package. I totally times the tariffs provided to Ruto's government is far much better than the one of the old government. And why do I say so? 17,000 to 30,000 for cesarean section. That alone tells you, in terms of investment alone, it's a big difference. And it's a very comprehensive complementary package. And it does not wait for a budget to be allocated. Yeah. It is there. Secondly, the 400,000 teenage mothers in our country are fully covered. They just need to walk to any health center with their birth certificate or with their parents' ID. And now we have even developed what we call a special ID, a temporary ID for all our teenage mothers, all family. It doesn't cover only the mother, the child, even after they. Linda Jamii, Mr. Speaker, covers 28,000 per day. This was not present under Linda Mama. And I really want members to get to the package. Linda Jamii now covers anti-D as a whole day, if you ask me to comment. So I think we must thank. Prevention of teenage mothers, advocacy, we must do a lot of advocacy. It's a responsibility for all of us. We should not promote it, but we have no choice. They are our children, but we must see how we can reduce it. We must ensure our